So I'm going to share just a few final thoughts and summarization of the value and the deployment of this type of technology. We had some IT issues and lost Gabrielle. So in summary, this can also, can be applied to supervising procedures and doing telesurgery. We have a partner with Surgitel Surgical Loops, who have a high definition camera system that can be mounted on the operating surgeon's surgical loops that would enable a physician anywhere in the world or in unlimited number of people using the Google Meet platform or other video conferencing platforms to be able to seeing the field of surgery with the same field of vision as the operating physician in the other country. And so you could see how that could be very useful when you have individuals who maybe not working in their area of usual scope surgically, but have surgical skills and want some advice or assistance during a live procedure or guidance. That's capable of being done. We also we often will put a TV and use Google Chrome bits, which are basically USB computers that turn any display into a Chromebook. And so that, in combination with a wireless mouse and keyboard, makes a 70-inch computer screen that we put in the operating room, mount on the wall, that can be run either on site or could be run from remotely. And you can pull up the patient's electronic record. We do that so they pull up the record, from our EHR system, which is built on Google's ecosystem. We can then look at, CAT scans, MRIs, X-rays, laboratory studies, notes from the patient's chart live while we're doing surgery, which I think is great assistance oftentimes. And also we have an ability to pull up educational and training videos, anatomy, and show that live during the actual surgical procedure. And that can be greatly increase, I think, people's capacity. You can imagine the cost of taking a neurosurgeon from Harvard, a pediatric neurosurgeon from Harvard, and sending them to a place like Cambodia, as opposed to them supervising a neurosurgeon who's knowledgeable with good surgical skills, who just doesn't feel comfortable or has not done this procedure very much and likes some support and guidance. So it's I think again, this technology and is just amazing, and it's all free too. Google is very generous with their nonprofit organizations, giving these platforms away for free, and you can achieve comparable levels of medical care to very expensive electronic records and video platforms in the United States using these tools from Google. Of course, our ecosystem and our EHR and patient medical record does not include billing, and there's a lot of integration and complexity that goes into an electronic record that is integrating a lot of these other things. But we do have an ability, with doing this, to see a patient, to document them real time using voice to text for all of our dictation, which is significantly faster than typing. And then all the language capabilities that allow us to very quickly translate documents to share with patients and share with physicians and other languages, to have a collaborative type of practice with in-country doctors and patients that are being seen remotely. So I hope that this has given everyone a good understanding of how these technologies can be brought together to provide a very high level of care. I think seeing this patient here would have been, considered at least a complex outpatient visit. We were able to assist this patient who could not find her medication, flecainide, We were able to form a treatment plan, establish a plan of monitoring as we're adjusting her medicines, and we kept her from having to go to the hospital in the Ukraine right now, where they're under great stress, and she was not able to contact her specialist, and I think that we were able to accomplish what would have probably been an ER visit, and provide a level of continuity of care fairly quickly, and easily, and certainly, I mean, at no cost, just a little bit of our time. So as we're moving forward, I talked a little bit about DC and Amy. There are things that are in their platform that are obviously significant add-ons with regards to credentialing and documentation and bandwidth, that make that the long-term deployment tool. But as I said, I've been using this type of technology to supervise procedures, patient care, and documentation. I can probably work up a patient as far away as Cambodia for abdominal pain and evaluate them with a diagnosis of appendicitis in about 4 hours, with me seeing the patient, initially examining them with the assistance of someone over there. We employ other tools like Echo device, which is a digital stethoscope that provides an EKG reading, as well as audio recording of heart sounds and lung sounds. And we also use a thing called a denoscope, which is a digital microscope that enables us to do an oral exam, to do an ear exam or endoscope exam, again, recording video or stills live, and which can be saved and embedded in the chart for both of those things. And the digital scope we can also use for looking at skin lesions, and so you can conduct a fairly good exam with either the patient examining their own belly, or having a more comprehensive exam with the heart and lung exam with an assistant using kind of acting as your ears over there and giving you the the audio component of that. And with the denoscope giving you the visual component of things, just by actually using the tools over there, and using a Google Meet call as your video platform for sharing that information and sharing screens. So a lot of this stuff is discussed and shown in some of our videos on our YouTube channel and on our website. But I think we live in a really fantastic time in many ways, with the way that technology, when used properly, can greatly enhance our ability to take care of patients in a very effective manner. So again, thank you for Gabrielle and Ina, who is our translator, and Irina for agreeing to have us use her as an example, so we can use this video recording to show physicians, both in the United States and in the Ukraine, all the various resources that are available to them while making a telemedicine call. As a quick aside, something that we didn't go over and I failed to mention, but I'll share with you now, is that with the Google translating capabilities, even if you don't have a translator, you do have an ability to be speaking to a patient and using Google Translate. And at that time, you can be doing things just like this, where you could speak to the patient and say, we're doing a test right now to demonstrate how Google Translate can be used in real time to communicate with the patient if you do not have an available translator, period. Obviously, this may be less than desirable to not have an actual person as an intermediary, but in a pinch, it can be very effective, period, particularly when you're talking about the primary languages that are well translated by Google. Generally speaking, with these languages, Spanish, French, Russian, the error rate is extremely low, and the errors typically are not meaningful. Both parties will eventually pick them up when you get an odd translation, usually that's going to cause or prompt someone to say, geez, I don't understand that. So you can do this, and then the next step obviously would be to go ahead and in a chat message, you could go ahead and then copy this, okay, and then have it read to the patient.
Прямо сейчас мы проводим тест, чтобы продемонстрировать, как можно использовать Google переводчик в режиме реального времени для общения с пациентом, если у вас нет доступного переводчика. Очевидно, что отсутствие реального человека в качестве посредника может быть менее чем желательно.
While that's taking place, the patient then is sent the chat message, and she can now go ahead and read the translation that is taking place. So you can see that this is a pretty reasonable way of bridging the difficulty that sometimes comes up or exists, that you would like to get information and you need to be proceeding with something, and you don't have a translator immediately available to you. And that said, it's not perfect, but it's not so far off from perfect as you might think using these tools this way. And so again, I just wanted to add that on, because I think that the important thing with all of this is it's great to be able to make and come up with a proper diagnostic and management plan for a patient, but the important thing is making sure that you can affect that proper outcome with the patient, and that has a lot to do with providing good patient education in the patient's native language. And I think that these Google translating capabilities, which we've demonstrated in our call today, really show that you can do this quite well and provide an excellent level of care to the patient at a very, very low cost. One of the things that the focus of hcvi has been since we've been formed is to look at what we consider to be important healthcare concerns in the developing world, and to develop high impact, low cost solutions that are scalable by leveraging excellent technology such as these things that we've described here today. So thank you, everyone, and I'm going to sign off.